Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho.
What does a second case of the H1N1 virus in Ada County, a third for Idaho, mean? We'll have the latest information and take your questions about the swine flu. Learn more, stay healthy, and join the conversation. Dialogue is next. Hello, I'm Joan Cartan-Hansen. Thank you for joining us here on Idaho Public Television, on the World Wide Web, and on public radio stations. The World Health Organization believes 1 in 3 people could eventually be infected by this strain of the H1N1 virus, and that it could possibly take 2 years for this particular strain to gain momentum. Still, the pandemic level remains at 5 out of 6, while health officials wait and see how the swine flu spreads. Here in Idaho, a third potential case was reported today, Thursday, in Ada County, a 13-year-old girl in Kuna. She's apparently doing okay, and that's the good news. But questioning how she was infected and how an unrelated toddler in another part of Ada County fell, all remain unanswered. So how serious is this strain of the H1N1 virus? Are we overreacting, or is this the calm before the storm? And just what can we all do to stay healthy? Joining me now to update us on the latest information on this strain of the H1N1 virus is Idaho State epidemiologist Dr. Christine Hahn. Thank you. Appreciate it, Dr. Hahn. I appreciate you being here.
You're welcome.
And of course, we want you to be part of the conversation. If you have a question, give us a call toll free at 1-800-973-9800. Let's start that first question. What's the latest news?
Well, as you mentioned, just today we did learn that there is a young girl in our area that probably has swine flu. And when we say probably, we mean that our state lab has done the testing, which almost always CDC has been confirming when the state public health labs are reporting these cases. So we're pretty sure that that's the case. So obviously in Ada County just a few days ago, we didn't have any confirmed cases, and now we have 2 probable cases. And I think that is probably making people pay a little closer attention now to what's going on.
And the third case is up in Kootenai County.
Right.
Up in Kootenai County. Right.
The first Idaho case was a woman in Kootenai County who was also recovered.
It's good news that all 3 seem to be doing fine.
Right, that's very good news, and that is what has been seen in the United States so far, is that on the whole, although we don't have a whole lot of information yet, since only a few hundred cases, that is almost 900, but not nearly as many as we know get seasonal flu each year, that's not enough cases and not enough time for us to have the full picture yet. But so far, this flu is acting similarly to seasonal flu in that most people seem to recover, but a few people have gone on and had very serious illness, including hospitalization and then a few deaths.
So if you look across the United States, the bulk of the cases are in the Southwest, in the Texas area. I think we've got a map that's coming up from the CDC. Now, for some reason, Montana, North Dakota, South Dakota, and Wyoming haven't had any cases yet. Is that indicative of anything?
We don't really know yet. Certainly, of course, they don't have large populations, and you know, in Idaho, officially on the CDC map, we only have the 1 case. We know now that we probably have 3. We're ahead of them a little bit, but it could be that in those states they still have probable cases that they're working on that CDC just hasn't had a chance to confirm yet.
That's right. Look, let's talk a little bit about this virus. Why is there such a panic over this particular strain?
Right. That's a very good question, because one could say, gosh, if it's acting like the seasonal flu, what's the big deal? Well, I'd say there are 2 things that cause us concern. One is that we know from looking back historically, when viruses, these flu viruses that seem to be made up of a mixture of human and animal ones.
As in the 1918 case.
Exactly. When we look back to 1918 and then again in 1957 and then again in the 1960s, we've had this happen a couple times now. Looking back, it's clear that a new animal flu got into the human population, and that seems to be what sparks these pandemics. So that's this could be a warning sign that that is going to happen. The other reason this was very concerning, especially initially, is the only information we had was from Mexico, in which things looked very serious, with initial reports of quite a number of deaths. Since then, of course, there's been more work done, and CDC and other health workers around the world have gone to assist Mexico just to get a grasp of this very complex problem. And things don't look not quite as serious as they did initially. But those two factors, the historical data, knowing that these types of viruses can cause this, and then seeing what was going on in Mexico, those two together gave us great cause for concern.
At what point do you feel that we may have gone too far, that we're crying wolf too much, and that people are, if they think, well, there's only 3 cases in Idaho, it's not that big a deal?
Right. I think, as you mentioned in the beginning of the show, we won't know the full story on this virus for several years. This might be that initial entry of the virus into our population that doesn't seem like much, and then next fall when flu season hits, this virus may hit harder. That is what was seen previously in the 3 pandemics we've talked about in the past. An initial mild wave was followed by a more severe wave, so it is definitely too early. I always say with pandemic flu that it's kind of a lose-lose in a way for public health, because if it doesn't turn out to be too bad, we look like we're crying wolf. If it turns out to be really bad, we will never have done enough to protect everybody. So it's a very tough situation, but I think we felt like we had to warn people and be vigilant, try to get a handle on this. And now our duty, I really think, is to let people know that it's too early to be completely confident that this isn't going to possibly turn more serious maybe next fall.
Okay, let's see if we can get to some of our callers. I think John in Boise. John.
Yeah, hi. I got a question. What signs do you look for in the swine flu?
What are the signs of the swine flu? Okay, good question, John.
Yeah.
So what are some of the things that you look for?
Right. Not surprisingly, the symptoms of swine flu are very similar to seasonal flu. In fact, there's no way for a doctor to tell the difference just talking or examining somebody. So headache, fever and cough are really the most reliable symptoms, and then chills, muscle aches, etc. And then what we've heard is some people also get some vomiting and diarrhea with it as well. Okay. So that's a little bit unusual for flu, but most people, it looks just like the regular flu.
So if you start feeling these symptoms, at what point do you go see a doctor?
What we're recommending right now is that if you're sick enough, if you feel poorly enough that you would normally see a doctor because you just want to get it treated and you want to get taken care of, that to please go ahead and contact your doctor for evaluation. With flu, it's always better to go early, and sometimes, of course, people wait they've been feeling sick for a week or more, and then by then the treatment isn't effective. So we do ask people to go in as soon as they know that they're pretty darn sick.
And it's not just a cold.
Right.
You really got to have the body aches and the whole shooting match.
Right.
Okay.
It should be more than a head cold.
Okay, let's go to Olivia in Mackey. Olivia.
Yes.
Go ahead.
I came down with something today. I've been throwing up all day, and I just need to know. Well, I have the chills, and I have my skin itches. Is that one of the signs?
Itching is not described as a symptom of the flu. However, I would say that if you feel sick enough that you really, this is not normal for you, it sounds like, and you really are feeling pretty sick, I would suggest you call your doctor and get in tomorrow and see if they can check you over. It doesn't sound like it's swine flu or influenza, but you never know. I did mention that vomiting, diarrhea can be part of it, and you should probably be checked out.
Great. And let's go to Norma in Ontario. Norma.
Hi.
Hi.
I'm calling because I heard you say something earlier about the 1918 flu, when it was a mixture of human and animal flu. Now, is this why we're having this trouble of insisting on calling it swine flu? I get very upset at that.
Yeah, pigs kind of got a bad rap in this one.
Right. That's a very good question. And you may notice that public health, we have tried to call it more the H1N1 flu, which has its own, it's not a perfect name for it either. I think someday we'll have a really good name for this virus. But it does indeed have elements in it, genes that it has taken from a swine influenza strain. So yes, you're right. This virus is a mix of human, swine, and actually it's got a little bird flu in it too. It's a real mishmash. But I think we are moving away from calling it swine flu. People have been concerned about that, concerned about the people being afraid to eat pork, that type of thing, and we want to reassure people it is perfectly safe to eat pork. And pigs, if anything, should be protected from us. We often give pigs influenza ourselves, and indeed that's happened in Canada. Now there's been a herd infected by people.
So yeah, pigs really have had this. It's not their fault.
It is not their fault.
But why are pigs such a good vehicle for transmission of the influenza?
Right. Well, influenza viruses, where they really live, where they're really are the most varieties and they're most at home, are in birds, and that's why we've talked about bird flu in the past so often as a potential concern. But pigs, people, dogs, horses, all sorts of animals are susceptible to influenza. But we're close to pigs. We interact with them a lot through farming and other ways, and that's one reason why that virus has gotten adept at jumping back and forth sometimes.
If you have a question about swine flu, we'll give that. So the H1N1 virus, 1-800-973-9800. Let's talk a little bit about ways to stay healthy. That's always, there's some basic general piece of advice, and we've got a few that we can put up on the screen for you. First thing is wash your hands. How important is it to wash your hands?
Right. We believe that washing your hands is very important for a couple reasons.
And also cover your nose when you cough. Cover your nose and mouth when you cough.
Right. In fact, that single piece of advice is probably one of the most important, because we believe that most often when influenza is spread person to person, it's from sneezing, coughing, or even speaking and being really close to somebody. So if you're, the really important thing is, if you feel like that, if you're sick, try to stay away from other people. So stay home from work. Don't send your kids to school if they're sick like that, because you really don't want them to spread it. But getting back to the hand washing question also, we know that influenza can also spread sometimes by contact, maybe shaking hands, that kind of thing. But it's not getting that on your skin that's the problem. You know, people really worry about that, about touching grocery carts and things. It's not that. It's that once you get on your hands, it's then touching your mouth or your eyes or your nose.
So avoid touching your eyes.
Avoid doing that so you can get home, wash your hands, that type of thing. So that's why hand washing is so important. It keeps you from infecting yourself, really, from your hands.
Okay, and we've got another is get enough sleep.
Yes, exactly. We know this for many diseases and many illnesses, and even your mental well-being. If you're not getting enough rest, if you're running yourself ragged, you are more prone to getting ill, and so we really recommend you take care of yourself.
So our next one is stay home if you get sick. Now, in a case in Texas where they closed the schools, the parents decided to have a ball game, get all the kids together. That's not what you mean when you say stay home when you're sick and follow the public health advice.
Right.
Stay home means stay home.
Stay home means stay home, and that's one thing that's been really hard. And I think one thing we've been lucky, if you will, within Idaho is a lot of this got figured out by the other states who had cases before we did. They tried to close schools, and kids just found other ways to get together. So it's not very effective. It's not a very effective way of keeping people isolated from each other.
Okay. Let's see, and our next piece of advice is follow the public health advice. Things like when they say stay home, they mean stay home. Our next one is find healthy ways to deal with the stress and anxiety. There's a certain amount of fear with this, and what are you telling people?
Right. I think I'm a firm believer in that knowledge is power, and that people that are educated are less afraid. You may still be concerned about things, but I appreciate people that are watching this show, trying to stay informed, going on the website for information, looking for information about this, because the more you learn about this, the more empowered you feel that you can do the right thing and be aware of what the recommendations are.
All right, let's go to Randy in Boise. Randy.
Yes, hi, how are you?
Good, how are you?
We have these probable or possible cases in Idaho that they've been talking about, some of them for more than a week. But on the national networks over the last 4 days on 3 different channels, they're using a test in Mexico City that gives the result in 12 minutes from any sputum, phlegm, or nasal discharge. Why are we waiting many days beyond a week to get an answer on whether or not these people have it or not when there's a 12-minute test being used in other countries? Are we that far behind?
Right. Let me answer that. A couple things. First of all, we only have 2 probable cases in Idaho right now. One was announced yesterday, one today. So we have not had cases for over a week. It does take a while, though, for CDC to confirm, like with our Kootenai County woman. It did take I think it was 4 days. I think we sent the sample on Thursday and we got the answer on Sunday. So there is a bit of a delay, and I want to emphasize, though, with our probable cases, which is what we're calling them, we're following the CDC guidelines and how we're calling those cases, 95 to 99% of those are being confirmed at CDC from all states. So really, as far as we're concerned, we have our answer. And we are treating those as seriously as if we had a confirmed case. So in a way, in Mexico, I don't know the details of those tests down there, but I know CDC and WHO, the World Health Organization, have been down there and are using, because of the urgency of the situation and because of the lack of testing abilities right there, have brought testing in with them and are probably just able to get an answer a lot quicker because they're right there on the ground on the scene doing it. We don't feel that we need that because we are able to move forward even with our probable case information. We're getting people on treatment right away. We're separating them from others. We are testing other people and treating them. So we are very confident with the results that we're reporting on and that we are acting on.
Okay, let's go to Ann in Lewiston. Ann.
Yes.
Go ahead.
Will you be able to prepare a vaccine for the next flu season in the fall?
Vaccines, that's a big point. Thank you.
Vaccine is a really big issue, and a couple things with that. One is that, yes, CDC has already initiated the process to start a vaccine on this, working with the World Health Organization and with private pharmaceutical manufacturers. They have 8 facilities around the country that they've already gotten samples of the virus, and they're already starting work. Now, that said, if it will be at least sometime next fall before that vaccine will be available. Making a vaccine takes a lot of time, not only just to get the technical process, but also the quality assurance. We all want to know it's safe. Right. And that brings me to the other issue with this vaccine is that, as many of your viewers will remember, back in 1976 there was a swine flu scare. Vaccine was quickly passed out and many people took it, and then there were safety issues with that vaccine.
And a few people died.
And some people died from it, and since then some people won't take their flu shot because they don't trust flu shots ever since then. So the CDC and public health departments are going to be very cautious to first of all make sure that this vaccine is safe and also make sure it's needed. We don't want to get a vaccine out there too quickly and then have the swine flu, as we traditionally have called it, and we're now calling it H1N1. We want to make sure that we don't do more harm than good. Right. So there's a lot of issues with the vaccine. That said, we hope that if needed, there will be one available next fall.
Does this mean we're going to have 2 vaccines? Our regular one that has already been in production, so it would be ready for distribution and
yes.
already tested for so that one covers different strains. It doesn't cover this particular strain.
Exactly. It is almost certain that the regular flu shot that has already been in production now and underway for several months will remain the same with the same vaccine viral elements that it will be trying to protect against, and that there may be a separate swine flu vaccine produced if indeed that's needed. And I think that's going to be a real difficult message for us this fall to make clear to people that most likely we'll be recommending seasonal flu for the regular flu, if you will, and may or may not have an additional shot just for the swine flu. And we won't know more about that till later this summer when we see how the virus is behaving.
All right, let's go to Jolene in Idaho Falls. Jolene.
Hi.
Go ahead.
Hi, I've got some concerns with them not shutting down schools with children that are possibly sick in their area, because little children in grade schools go across the hallways and are raising their hands up and slapping hands with each other as they go through the hallways, which gives them hundreds of germs. And then you see other little children going up and down hallways in schools, dragging their fingers across the wall.
It's hard to keep kids from not sharing germs.
Right.
And my concern is if they don't shut down the schools, then kids are really spreading a lot of germs.
And let me ask. Initially, the CDC did recommend closing schools in Texas and New York. Literally shut their doors.
Right. That the caller makes a very good point and has a very valid concern. Initially, as you mentioned, the schools were shut down in many other states. And what's happened is that CDC did reverse themselves on that. The states found that it was not working. There's certainly some good arguments for shutting down a school. But the problems are many in doing that. First of all, as we've already talked about, the kids would then go share their germs in other ways because parents couldn't always. For example, what was happening in some places was they were shutting down a school, let's say, of kindergarten or young age kids, and the parents would then put them in a daycare or some other setting where they were just around a whole bunch of other kids, and then it could be spread even further. Secondly, The other thing is that by the time you find that first case, it is very possible that spread has already happened in that school, and you're actually making it harder to monitor the situation. Public health departments were saying, gosh, if those kids are all in school, we can say, oh, there's 3 kids absent, we could follow up with the families, we sort of can monitor what's going on. Once they're out of school, we don't have any sense of what's going on in that community anymore.
But that's not to say the school can't do things to make it better.
Right. And one other point I want to make, with a single case in a school, that certainly is the recommendation not to shut it down. However, if there's evidence of a lot of spread, a lot of kids are out sick, that's still an option. It's not completely off the table. There are times when school closure might be the right thing to do.
So CUNA, there's not a recommendation to close the middle school in CUNA, the third case that was announced today.
Right. Correctly. With a single case right now, they are not planning to close, but if more information becomes available, that could change.
Okay, let's get to, let's see, Jim in Pinehurst. Jim.
Oh, hi.
Hi, go ahead.
Yeah, a real quick question. How long does that virus live outside of a host?
Okay.
That's a very good question. The flu virus in general, we have some data from experiments that have been done with, putting the virus on tables or surfaces and then seeing how long it is able to behave like a virus and infect people. And the answer has varied from different studies about flu viruses, from a couple hours to several days. With this particular strain, of course, it's too new to have that kind of information, but we expect it's probably like the regular flu virus, where it can certainly survive for a period of time on surfaces. And that kind of gets us back to why we recommend the hand washing and so forth.
Okay. There's a couple, now, not to be the bearer of really bad news, but the H5N1 bird flu, which does have a much higher death rate, has kind of started to resurface. It first appeared a few years ago and then kind of faded off. Is this another strain we have to worry about?
Well, in public health, we've never taken our eye off of bird flu. It certainly has dropped off the headlines. We got tired of talking about it. People got tired of hearing about it, and it seems like nothing's changed. Nonetheless, it continues to infect people around the world. It continues to have a very high mortality rate. And, people in public health are still watching it. We're very fortunate we haven't had it here in the U.S., so we don't see an imminent risk from it, but we're continuing to watch it very closely.
And West Nile virus is another, I don't want to confuse people because we're talking about swine flu, we've talked about bird flu, but this is something that has killed people here in the state of Idaho. We're heading into that season because it's a mosquito-borne illness.
Right.
So I'm going to give you a chance to warn people about that one and make some recommendations.
Right. And with West Nile virus, we had one really bad year here in Idaho, and that was 2006, as many of your viewers will remember. And since then, it's been quiet. But again, with new viruses, and that's how it really ties in well with what we've been talking about, when new viruses come into a human population, we can mostly observe and try to learn. It's very hard to predict. And so with West Nile virus, we don't know if this year is going to be a bad year, if it's going to be another quiet year. We always try to learn what we can. Mosquito populations, is it a wet season? Is it a cold winter that killed all the mosquitoes? Hopefully in a few years we'll know more and more about how this virus is going to be and whether be able to predict better. But right now we're not there yet.
So use your DEET and long sleeves and stay out at dusk and dawn and eliminate water sources or stagnant water sources around your home.
Exactly. So we do advise people to be very cautious about mosquito bites. I know when I was a kid, I was covered in mosquito bites. You just didn't think about it as a health risk. Well, that's changed, and we just really need to avoid mosquitoes.
Okay, let's see if we can get to Gus in Idaho Falls. Gus.
Yes, I'm just calling. I'm wondering here, aren't they blowing this just slightly out of proportion? I mean, what are the chances of actually dying from this?
Right. Gus, you raise a really good question. A couple things. We are trying really hard not to blow it out of proportion, but to make people aware of a possible risk. And as we've talked about earlier, not necessarily today or this week, but maybe this fall, maybe next year, maybe never. We can't predict it, but we feel it's our duty to warn people and let them be aware. The chance of dying, again, from New Mexico, they have apparently a much higher death rate than we are seeing here in the U.S.
Mexico, not New Mexico.
Did I say New Mexico?
Yeah,
I am
in
sorry.
Mexico.
In Mexico.
Right.
In Mexico, they're seeing a much higher death rate. But in the United States, what we've seen so far is 2 deaths reported. And it is important to remember, though, 2 deaths doesn't seem like a lot, but that's out of fewer than 900 official cases. And so the risk seems low. But remember, one was an infant, a 22-month-old. One was a woman in her 30s who was pregnant. So these are not people that you want to, of course you want to don't have anybody die, but the risk isn't zero, and the risk could change over time if this virus mutates and becomes more aggressive this fall.
And smokers should be aware. I want to give you that. They're at a greater risk.
Right. The risk groups for this virus so far, looking at the early data, seems to be similar to seasonal flu. So people who are elderly, very young, pregnant, have immune or other health conditions, or smokers need to be particularly aware. And with you bringing up smokers, it reminds me of one point we haven't made yet. If people try to think about, well, what can I do? What can I really do other than trying to
cover your cough
and
wash your hands?
Yeah, the general recommendations. Yeah. One thing I want to remind people of, there is a shot out there which is commonly called the pneumonia shot, and it protects against certain types of pneumonia, bacterial pneumonia. And this shot, most people that should be getting this vaccine right now just haven't bothered or haven't, may not be aware of it. That is what, in the 1918 pandemic, that is what killed many, many people. Not the virus itself, but bacterial pneumonia that set into their lungs after the viral infection. If you went and got that shot this summer, go to your doctor and ask for the pneumonia shot. This is particularly recommended for elderly, smokers, people with heart or lung conditions. Get that shot now, and that may really do a lot of good for you this fall. Whether swine flu hits or not, whether it's a seasonal flu, it's very protective.
And the last piece of advice to help people, what they definitely need to know about the H1N1 virus.
Right. What I would ask people to do is to try not to tune out about it. We're very relieved that so far in the U.S. it doesn't appear to be as serious as we first feared when we heard about what was happening in Mexico. But this fall we're going to be talking about it again, because we're going to be watching and waiting to see if it comes back. And please stay with us and stay tuned and take precautions and stay with us. And we'll try to keep you informed and tell you everything we know.
All right, Dr. Hahn, I appreciate you. We've run out of time. I appreciate you joining us this program. If you'd like more information about the H1N1 virus, you can go to the Dialogue website at idahoptv.org. There's links to the state's pandemic flu page, the CDC, the national, many other places you can find that all at idahoptv.org. And by the way, we're also on Facebook. So search Dialogue for Idaho Public Television and become a fan. Thank you for tuning in, and join us here next time for Dialogue. So now we get to sit here while they slowly run people's names over our face.
Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho. To order a copy of this program from Idaho Public Television, call our toll-free number or visit us on the World Wide Web